Hi everyone, thank you so much for joining us for the first webinar in our series on mental health education. My name is Leah Landry and I'm the Associate Director for Communications and Advancement at the Massachusetts Association for Mental Health. MAMH is a statewide nonprofit committed to making sure people have the resources and opportunities necessary to protect their health and well-being. That includes mental health. Each day, MAMH brings together people to achieve that goal by sharing information, lending expertise and insight, and advocating for change. The goal of this training is to help you understand child development. We'll have more like this one available on our website, mamh.org, along with several other mental health resources. This training series is focused on helping students, families, and caregivers better understand mental health. While we cover topics like mindfulness, grief, and other specifics in these lessons, it's also helpful to think about how we develop through childhood. It's our hope that this lesson will explain some of the context behind the more specific topics we'll cover in later trainings. You can see what we plan to cover today on the accompanying slide. If ever some of these ideas seem a bit hard to understand, you can always ask a trusted adult, caregiver, parent, or other family member to explain. Or, if you have the time, watch this training alongside a trusted adult. It should take about 10 to 15 minutes. You might both learn a thing or two about development, social-emotional learning, and strategies to support this kind of learning. There are numerous theories to explain child development, but we'll focus on two this time around: Piaget's cognitive developmental theory and Bandura's social learning theory. Piaget's cognitive development theory includes 4 stages. In this theory, it's understood that children move through these stages, gaining knowledge and acquiring skills through a process of observation and experimentation. Many of the skills and knowledge specifically identified by Piaget align with social-emotional learning, also known as SEL. Bandura's social learning theory states that children learn by observing and imitating models. Think of models in this context as similar to role models, like parents and caregivers. Bandura's theory states that if when a child models behavior, they're rewarded, they will continue the behavior. An example, a child often observes their caregiver saying please or thank you and starts to do the same. The child's then praised for using good manners, so they continue to do so. The same is true for observations. If a child observes that another person's behavior is reinforced, they'll imitate the same behavior. This process of observing, modeling, and reinforcement is not limited to behaviors. It pertains to values, beliefs, and attitudes as well. If caregivers model compassion, positivity, and respect for others, youth will learn the same. Similar to Piaget, Bandura's theory aligns well with SEL. We've mentioned it a few times now, so we'll jump straight into asking, what is social-emotional learning, or SEL? SEL includes 5 core competencies, or abilities: self-awareness, self-management, social awareness, relationship skills, and responsible decision-making. Each core competency also includes a set of sequential skills. Self-awareness is the ability to recognize and name our feelings, and better understand our emotional response and behaviors across different situations. Why do we feel or act the way we do in certain scenarios? Self-management refers to our ability to regulate feelings, manage stress, and promote wellness. Social awareness includes the ability to empathize with others and understand and respect diverse perspectives, like when you feel strongly for a friend or loved one experiencing a difficult time. You may not have to deal with the sadness or stress they're experiencing, but emotionally you feel aware, respectful, and attuned to their experience. Building on self and social awareness, relationship skills include communication, conflict resolution, problem solving, and teamwork. And finally, responsible decision-making is the ability to use sound judgment to make healthy choices. Research shows us that supporting youth to develop these skills has a lot of positive outcomes. It increases ability to manage stress and depression, promotes positive attitudes about learning and school, and decreases substance use. That's why the Massachusetts Department of Elementary and Secondary Education provides recommendations to schools to include social-emotional learning. Your school has likely developed a plan to teach these skills across each and every grade level. Hopefully, you've already learned some of these skills, either in school or from the adults and caregivers in your life serving as models. If you want to learn more about the research behind social emotional learning, you can visit the Collaborative for Academic, Social, and Emotional Learning website at casel.org. There are ways that we can support ourselves and others in learning these skills that we've talked about. Scheduling regular check-ins, either with yourself or as a family. If you're having trouble finding a time to check in, try being consistent with the time of day or activity that you choose. Use dinner time or bedtime as a target. There are just a few tools that will make these easier, like mood meters and apps, or on the low-tech end of things, just simply taking notes or journaling. You can also try changing up the way you or your family communicates emotions. It's true that not all families, friend groups, or individuals talk openly about feelings, but there are a few ways to start that don't have to be uncomfortable or awkward. You can use writing, like a text message chain, message board in a common area, or even a notepad. Make sure that it's clear to yourself and others that it doesn't all have to be sunshine and roses. You can express positive messages or vent about challenging days. Today is not my day, and I'm going to need some space is just as acceptable as I'm feeling on top of the world today. When you reflect on your own feelings or a family member's, you can use some of your SEL skills to respond to these messages. As an individual, group, or family, identify some healthy coping strategies like walking outside, eating well, unplugging, or setting aside time to scroll on TikTok, fueling your body, or getting good sleep. And remember, these things aren't just good for your physical health, they're good for your mental health too. Thanks so much for being with us today to learn about how we develop. Our next webinar in this series teaches you about trauma, and there will be many more to come about mindfulness, grief, and other topics. In the meantime, if you'd like to learn more about mental health and your experiences, visit the mental health education pages at mamh.org. You can find resources for K-12 students and more. We'll see you soon.